Yesterday, I was a bit cryptic early on in the show when we were talking about mass layoffs at a local health system, and now we've got confirmation that it is Memorial Health System, which is looking to lay off around 274 people, I believe. Welcome back. It is Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and Talk. So Monday night, got some notes from some listeners who said, hey, either my wife was safe from the layoffs, but a whole bunch of people in her various capacities of Memorial Health were being laid off. And then I had somebody else message and say, hey, I survived, but there's a bunch of layoffs going to be happening. And some of the other messages were, it's upwards to 600 people, or it's about 200 people. We got at least some background information that it's about 270 some odd people. And these are jobs that obviously are going to, without it, hurt a family somewhere. People are likely, finding themselves waking up this morning looking at the Help Wanted ads. And it's never something fun to hear about, but getting that confirmation from Memorial, we also got a statement from Memorial. So I want to share that with you now here again with Springfield's Morning News. The statement from Memorial says, in response to current national and statewide economic trends negatively affecting the healthcare industry, Memorial Health is restructuring to reduce its workforce, focusing primarily on leadership, administrative, and support positions. Several hundred colleagues are affected, including 20% of leadership positions across the organization. This reduction represents 5% of Memorial Health's total salary and benefits. So again, 5% across the board. Departing employees will receive a severance package, a health insurance stipend, and support resources. Some individuals may also be offered the opportunity to transfer to different roles within the organization. Statement from Ed Curtis, the president and CEO of Memorial Health, said this is a difficult decision that was made after careful analysis and implementation of other cost-saving measures. Memorial Health is not immune to national trends, such as rising costs of supplies and equipment, high cost of labor, and shifting trends in payer reimbursements. We are committed to continue to provide the highest quality care for the communities that we serve, and this action, while painful, enables us to focus on our core mission. So that's the statement. And again, we got some other indication, internal emails showing that Memorial Health, quote, is not immune to national trends, such as rising costs of supplies and equipment, high cost of labor, and shifting trends. Total number of staff reduction was not provided. One source suggested it could have been hundreds laid off. An internal email from Curtis to employees said that while we have made progress, our expenses continue to exceed our revenues. And unfortunately, our cost-saving measures have not been enough. However, in difficult times, we must refocus on our core mission to improve lives and build stronger communities through better health. Again, the total number of employees impacted by this, around 274, and that's 114 leaders and 160 other workers. So that makes up about 5% of Memorial's workforce. Are you impacted by this? Is your family impacted by this? I'd love to hear from you at 217-629-7970. And I've already gotten indication from some that they were able to shift into a different position, maybe with a lower pay, but they're happy to keep their job. This is an indication, as the statement said, of national trends, of state economic trends. But if you look back, the past quarter, really, there hasn't been the COVID emergency nationally. Is that playing into this, right? Did they get through a quarter of a year and then realize, wait a second, we don't have all of these COVID-19 dollars coming in anymore, or that pipeline of dollars, the potential of those dollars. So did that play a role into this? They just simply said that they have projections of expenses outweighing revenues coming in. It's not saying they're going broke, but proper management, you look ahead, you predict, you try to brace for impact. So is this just part of that? And I remember when COVID began well over 3 years ago, And they had all this mass hiring and all of these travel nurses that were coming in, which were much more expensive. There was, it was gangbusters for the health industry, right? The healthcare industry was hiring, and they had a lot of money coming in. And even at the beginning part of COVID, I remember thinking, there's going to be some mass layoffs eventually when this settles down, and it's not going to be pretty. So there's some families right now wondering what their next steps are. I'd love to hear from you at 217-629-7970. Thanks for hanging on. Good morning. You're on WMAY.
Good morning, Bishop.
Hey.
You like to investigate stuff, so look up the top 10 CEO pay in Illinois.
Okay.
And that's all I got to say. Thank you.
And listen, I think I've heard this as well. People point out that, Curtis, the president and CEO of Memorial, makes millions of dollars a year. But from my understanding, he did himself take a pay cut at the beginning of COVID. I don't know how accurate that is, and I don't know the exact amount that he makes per year. But, you got to think if somebody points out he made $10 million or whatever, people are going to point out to that and criticize that. That there's no question. But I don't know the legitimacy of how much Ed Curtis makes. Regardless, you've got a whole bunch of people that were let go from a local health system. Good morning. You're on WMAY. Your thoughts?
Oh, hi. One thing that you could look at is the reviews that employees have posted on Yelp and other places, but also the ER. They had like 65 reviews, 60 of them negative. And the problem with Memorial is they've been short-staffed for 10, 15 years. They will not hire people. They'll give their executives money, and they'll spend money on billboards and TV ads and rebranding, because after all, they're not providing health care, they're providing a product. That's why they've acted. And meanwhile, they're short-staffed, their staff is overworked, they're tired, they're quitting, and so this was inevitable. This train wreck of now we have to lay everybody off, we're broke.
Well, they didn't lay everybody off. They only laid off about 5% of their overall staff. And from my understanding is some of the sections that were let go were newer sections that they could easily outsource their responsibilities to, like, within, developing apps or something like that, or, just trimming the size of, a certain, ward or a certain section of the health services.
They were expanding when they weren't taking care of what they already had. And that is never a good business model.
Well, they were expanding during a time when there was a public health emergency. You agree with that or not? But I think all health systems were expanding. So obviously, there's families impacted by this, no question. And I think, one thing that this city of Springfield is blessed with is we got Memorial, but we also have St. John's HSHS. And you got two strong, medical systems here in Springfield that also have relationships with Southern Illinois University and all kinds of other educational institutions that do a lot of work here in Central Illinois. But that's the latest on the mass layoffs we talked about yesterday. And again, you're looking at about 274 layoffs. And the rationale given is while they are making progress on their expenses and their revenues, expenses continue to exceed revenues, and they had to take those cost-saving measures. All right, it is Springfield's Morning News. Somebody on YouTube says, Greg, national trends are going to impact St. John's as well. No question. And I think that is anticipated. I have yet to get any indication on that, but if you do have information, please do share it with me. And maybe I just go ahead and put out a request for comment from St. John's Hospital as well. All right, it is Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and